Cool. Welcome, everyone. My name's Kelsey. I use she, her pronouns, and I am on Wurundjeri land today. And I would like to pay my respects to elders past and present and extend that respect to any First Nations people in this session right now. I invite everyone to acknowledge what land they're on using the Zoom chat as well. So this session is the Future for Mental Health, Making Reform Real. I am very honoured to be emceeing this session for you today because it's a topic that's very dear to my heart and I imagine is dear to a lot of people in this room as well. The past 2 years we've dealt with bushfires, pandemic or recession, so many things that have intensified young people's mental health and the pressure on our mental health. At the same time, the Royal Commission into Mental Health has presented us with a roadmap for the future of Victoria's mental health system. This session today will explore how we as young people and us as the youth sector can contribute to the successful implementation of these recommendations and make genuine change in our system moving forward. So today we're going to hear from several amazing speakers who I'm very excited to hear from. We're going to do a short question and answer, and then at the end we're going to get to do an interactive breakout room session. So I will walk you through all of that as it happens. But before we do that, I just want to remind everyone that this is a bit different to the webinar before, so there's no Q&A feature, but you can just post your questions in the chat and some YACVic staff will make sure they get across to the speakers. I just want to give a brief content warning as well. This session will talk about and mention mental illness and suicide, so make sure you do look after yourself and please feel free to step away if you need to. One of my wonderful colleagues is also going to post some helplines in the chat as well that you can contact, or you can contact our child safety officers or support workers. Cool. So with that, I'm going to hand over to my wonderful colleague, Jen, who is going to moderate the session today. So Jen is the lead facilitator at YACVic and is currently studying a Bachelor of Social Work. Jen was first introduced to YACVic when she put her hand up to facilitate YACVic's consultations for their submission into the Royal Commission into Victoria's mental health system back in 2019. Growing up in the small rural town of Camperdown, Jen has been an avid advocate for mental health awareness in rural and regional Victoria. This passion has seen her start her own mental health first aid business, Empowerful, which she hopes would help tackle stigma, raise mental health literacy, and increase confidence in community members to have conversations about mental health. So with that, it is my pleasure to introduce you all to Jen.
Thanks so much, Kelsey. Hey everyone, my name's Jen. I use she, her pronouns, and I am zooming in today on Gunditj Mara country. I am so excited to be moderating this session today. I'm a young person and I live in a beautiful small town called Camperdown in the Great South Coast. So I'm a loud and proud country kid. Being a country kid is a big part of my identity. I'm the daughter of a farmer. I am an animal lover. Also, coming from a rural area, I have seen how the lack of mental health services we have out here affects young people like myself. And this really got the fire going in my belly. I don't think it's fair that young people in rural areas have to travel for an hour or more just to see the counsellor at Headspace. I don't think it's fair that our wait times are so long, or that we're told we should be thankful for telehealth being so accessible when, for many of us, myself included, don't even have NBN. So this is where my mental health advocacy journey started, and this is why it was so important for me to be a part of YACVic's consultations for their submission to the Royal Commission into Victoria's mental health system. And this is where it's led me today, moderating this session, which I'm so thankful for. But enough about me. I'm super excited to be joined by 4 amazing panelists who you'll be hearing from shortly. They'll also be answering questions at the end of their presentation. So if you have any questions, make sure you note those down in the Zoom chat function. But first, let me introduce them to you. We've got Pam Anders from the Department of Health. We've got Natasha Ludowyk, who did the evaluation for the Live for Life project. We've got Harmarie Cronje and Kirsty Fealy from Headspace's Global Ambassador Program. And first up, we're going to hear from Pam. So Pam is currently the Senior Executive Director for mental health and wellbeing transformation at the Department of Health. Pam has worked in complex policy and political environments. Before leading mental health reform Victoria, she was Director of Public Engagement at Oxfam Australia. Her senior management experience in a range of public policy, public sector management and communications comes from roles including the Director for Work Health at WorkSafe Victoria, Deputy Chief of Staff in the Office of the Premier of Victoria, and Chief of Staff in the Office of the Treasurer of Victoria. And at this point, I'm going to hand over to Pam. Thanks so much for joining us today, Pam.
Jen, hi, and a big hello to everyone. Thanks for such the introduction. Look, the real story is a big shout out to fellow Southwest Victorians. I'm a born and bred Port Fairy person, so born on Gunditjmara country, grew up down in country, and my family is still there. So I miss them at the moment because I can't travel, but that's where they are. So shout out to all you country folk here. My name's Pam Anders. I use she, her pronouns. I am coming to you from Wurundjeri lands of the Kulin Nations, and I'd like to pay my respects to their elders past, future and present, and indeed extend that to any and all Aboriginal people who may be on the call and part of this conference today. I would also like to recognise the people who have lived experience of trauma, neurodiversity, mental ill health, substance use and addiction, and their families, carers and supporters. And this recognition extends to the clinical and non-clinical workforces that support people with lived experience of mental illness. Really thrilled to be here today, and I'm going to talk a bit about the Royal Commission recommendations and the work that is in front of government and my team at the moment. But in doing so, I just want to call out now a bit of a confession, because I'm probably going to use a bit of sector speak. I'm probably going to use a little bit of bureaucratic speak as well, but I'll try and cut through where I can. But I also really keen to hear the session after this, because it is your experience, it is your expertise that needs to drive the implementation forward. And by starting there, I want to acknowledge just the significant contribution that YACVic made to the reform agenda. The engagement with YACVic with the Royal Commission not only heavily shaped the final deliberations of the Commission, it was how you did that engagement that also shapes the recommendation. So it wasn't just what the Royal Commission recommended, but the way in which the Commission has said to government, going forward, you have to co-design, co-produce and engage communities in the delivery, is a big testament to the way in which YACVic convened the discussions and brought the voices of youth to the table. So a big shout out. I think we've got a lot to learn from the way in which you guys have operated. I'd like to also acknowledge the contribution and leadership of so many young people and families and carers who shared their story. It is your stories and your experience that really, rest heavily on the shoulders of the implementers now to bring this forward, and the opportunities in front of us. As Jen said, I'm the Senior Executive Director in the Mental Health Division, part of a team working closely with people with lived experience, local communities, to design and implement the new recommendations. So I'm going to try and focus a bit on the reforms coming from the Commission that are most relevant for Victorians aged 12 to 25 years. But before I do that, I just want to note that these reforms come at such a critical time in Victoria, and at the risk of kind of just stating the very obvious, not only do I hear, but I see in the data and the insights that I have access to working in government, just the challenging times at the moment, particularly for young people, whether it comes around education, work, housing, health, identity, relationships, and concerns for the future. Whilst the COVID pandemic has been difficult for everyone, I think for young people it's been particularly challenging, and that challenge is only just starting to kind of surface really clearly, and I think it's a challenge that is going to be with us for some time. It's not something that's going to disappear quickly. A bit about the Royal Commission. The Royal Commission set out a very ambitious 10-year reform agenda. Not only did it basically say to government, mental health and wellbeing system is broken, it is barely coping with providing the support and services that Victorians need now, let alone what is required for the future. So in doing so, it's laid out a very ambitious blueprint for the next 10 years. There were 65 recommendations, in addition to another 9 recommendations in an interim report provided to government about 12 months earlier. I think what's really exciting is the Victorian government has unambiguously said, yes, we are implementing all. It has not hesitated. It made that commitment before it saw the final report, recognising just how critical this is. And I think this year's budget, the state budget, delivered the first of that investment to really get the work started. And it delivered a record investment of $3.8 billion into Victoria's mental health and wellbeing system. This is a massive increase on any investment that's seen previously, and I think marks a real turning point in terms of not just genuine system change, but significant uplift and capacity in the system now. So when it comes to things like accessibility, wait lists, providing more age-appropriate supports that comes online as quickly as possible, you're not waiting for 10 years to see the impact of the reform. So not everything was funded in this year's budget. As I said, it's a 10-year plan. This was the first tranche of investment. So let me describe a little bit about what's focused our reform efforts for young people, particularly this year. Firstly, we're establishing dedicated pathways and models of care for people between the age of 12 to 25. We're establishing 13 new youth area mental health and wellbeing services, which will provide dedicated support, treatment and care of young people. This will be complemented by what we call more contemporary models of care. So including integrated treatment, care and support for young people experiencing mental ill health, alcohol and other drug dependence. What do I mean by contemporary models of care? Well, it's not necessarily a very dominant medicalised model of care. It's a model of care that recognises a multidisciplinary approach in supporting young people, not just psychiatrists, but working alongside occupational therapists, working alongside allied health services, trying to take a much more relational aspect and person-centred kind of care that needs to be provided. And I'll talk a little bit more about that. It's also going to be complemented by significant training and development for clinicians and support workers, as I said, to provide developmentally appropriate care and support to young people and families, including training in mental ill health that is really prevalent in young people, such as eating and personality disorders. We're also implementing a new mobile targeted assertive outreach, which is going to be aimed at providing help to young people to seek support where they're most comfortable, such as in their homes, in their accommodation, if it's temporary accommodation, schools and outdoor areas as well. We're also establishing the first of 5 new youth and prevention recovery care units, otherwise known as YACVics, which offer really a step up from community supports and cares or a step down from hospital, but it's effectively 24 hours support delivered in a home style setting, much more appropriate than necessarily being in an acute or a hospital setting. There's improved access and service provision. So secondly, we're improving access and service provision across a broad range of services. There will be enhanced support for Aboriginal children and young people to access specialist mental health services, intensive multidisciplinary care, but importantly, support and choice within culturally safe community settings, whether that's community controlled organisations or mainstream mental health services. We're also focused around delivering recommendations aimed at supporting rural and regional Victorians, including trialling 2 new digital services and improving non-government helplines, and particularly enabling rural and regional Victorians to access support from their homes. In relation to suicide prevention, we're rolling out statewide a program that's called HOPE, otherwise stands for Hospital Outreach Post-Suicidal Engagement, including in rural and regional areas, and we're establishing 4 new child and youth hope services. We'll expand the Healthy Equal Youth Project and a suicide prevention grants program to support more young LGBTQI+ Victorians. The HOPE program effectively is supporting, it provides effectively 3 months support for people who may have experienced suicide ideation or presented to emergency departments. And this is really critical because it takes the person from the hospital and looks after what they need and works with them in terms of what that support they need to get back onto a pathway of recovery for a period of time after such a traumatic episode. There's also going to be additional mental health support and primary medical care and peer supports for trans and gender diverse young people, while young people living with mental illness who are experiencing homelessness will also be provided with supporting housing and wraparound care. Recognising the unique experience of young carers, there's also new funding this year to expand the range of supports across our state for young people and children caring for a family member, including more funding for the Satellite Foundation and families where a parent has a mental illness program. We're extending enhanced mental health and wellbeing support in schools and for young people in contact or at risk of coming in contact with a criminal or youth justice systems. I hope that gives you just a sense of how wide-ranging the reforms are, which I said wouldn't have been possible without the voices of young people shaping those recommendations. Finally, there's also a range of reforms that will strengthen the foundations of our system. So let me highlight a couple of these. We'll be putting people with lived experience at the centre of the reform process. So the services we design and roll out better meet the needs of people who use them. Secondly, we're standing up an Office of Mental Health and Wellbeing Promotion and Prevention, which is about supporting more people to talk openly about mental health and illness, contribute to destigmatising mental illness, and to promote early help seeking and give people the tools to better support their own wellbeing. The system of change that's required is ambitious, complex, and will take time. We are taking a staged approach, and we need to strike the right balance between the most critical and urgent challenges here and now and the long-term complex reform. But we're only at the beginning, and I'm really excited to think about and plan how we can work with you to bring these reforms to life. We'll draw on a range of approaches and tools for engagement, which is going to vary from co-design to consultation, depending on the nature of the work and the timeframe set by the Commission. Engagement will be undertaken in a variety of ways on different reforms, which might include roundtables, advisory structures, digital platforms like Engage Victoria, and we'll be working with YACVic and others to explore what those options look like, what's going to work for you to engage you in the best possible way. And I assure you there's going to be a number of opportunities to do this. In closing, I want to make a few remarks. We all have a really important role to play in building a new health and wellbeing system, and one that we can be really proud of, and that's going to not just serve this generation, but many generations to come. I think reform of this size requires strong leadership from across government, from workforce service providers, peak bodies and people with lived experience. I've used a number of numbers, and as I said at the beginning, quite a bit of sector talk speak. So I want to leave you with a really clear picture of what success looks like when we are successful in implementation. I'm conscious of time as well, thank you. There will be more youth-friendly ways to seek help, including in education settings, closer to home, and peer support to help you. Services will be easier to access because they'll be more flexible in when and where they will be available to help you. Across services, there will be a consistent culture of how can we help, rather than how can we refer you on, or are you eligible for this program? And help will be available much earlier, rather than only when a young person's mental health and wellbeing challenges are clear enough to be diagnosed as a mental illness. We will have increased the number of young persons who can be helped in places where they live, learn and work. Treatment and care and support that you receive and your friends and families and network will receive will be appropriate for age and delivered in the relational context of your life, recognising that the different ways in which young people choose and want to live their life, their interdependence, stage of life they're at, whether it's secondary school, higher education or the workforce. The underlying approach should be that young people are experts in their own experience and should be supported to make their own decisions from the very first interaction with services. So in closing, would like to thank each and every one of you, particularly those who have worked really hard behind the scenes and have got a lot of vested interest in the recommendations and your dedicated support and advocacy. So thank you. Really looking forward to the rest of the panel.
Amazing. Thank you so much, Pam. That was absolutely wonderful and super insightful. And how amazing that we've got a fellow Southwest Victorian on the panel. We're so glad to have you here. So thank you so much. Up next, we're going to hear from Natasha Ludowyk. So Natasha is a program evaluator and research consultant practicing at Ludowyk Evaluation, working in mental health, alcohol and other drugs, education, employment, disability and community development, particularly in regional and rural Australia. From 2018 to 2020, she conducted an independent evaluation of the implementation and outcomes of Live for Life. Love it when Live for Life gets a shout out, a rural community-led place-based youth suicide prevention initiative in Benalla Rural City and Glenelg Shire. The evaluation validated the strength of the Live for Life model and produced numerous learnings about how to support young people's mental health and well-being. And with that said, I will hand over to you, Natasha. Thanks for joining us.
Hi, thank you, Jen, and hello, everyone. Thank you so much for inviting me to speak today. I use she, her pronouns, and I am joining you today from the lands of the Wathaurong people. I pay my respects to their elders, past and present, and I would like to extend that respect to all Aboriginal people and acknowledging that their sovereignty of these lands has never been ceded. Talking about some of the learnings from the Live for Life evaluation I conducted, I'd also just like to take a moment to acknowledge all people who've been impacted by suicide in a range of different ways. And I'd like to acknowledge the work and efforts of the communities in Benalla and Glenelg Shire, and particularly the young people who contributed their time and their feedback to the evaluation to help produce what we've learnt. Live for Life, for those of you who are not aware of the initiative, is a youth suicide prevention model for rural communities, and it brings together leaders and key people within those communities, including all of the schools, to deliver 4 key components. And it delivers teen and youth mental health first aid training to students at 2 points in their schooling, typically across all of Year 8 and Year 11. It also delivers that youth training to adults in the community. It creates local partnership groups to lead conversations and discourse in the community around mental health to aim to reduce stigma and engagement and networking across the community. It promotes young leaders as mental health ambassadors through its crew, which typically involves Year 9 and 10 students in a peer leadership model. And it also features sort of I guess, umbrella support from Youth Live for Life, the organisation who support the local communities in their implementation of this initiative. So it's currently being delivered in 6 rural communities in Victoria and continuing to grow into new communities all the time. The model has been evaluated over a number of years, and it first commenced in Macedon Ranges 10 years ago. I conducted an evaluation in 2 of the newer communities at the time, which was Benalla and Glenelg Shires, and that went over 2 years and really looked at how it was being implemented and learnings about how to implement better, as well as what impacts were being seen in those early years of delivery for those communities. So I just wanted to talk briefly about some of the key things we learned about this model in particular, and then reflect on what that might mean for mental health reforms more broadly, particularly for initiatives for young people and particularly in rural communities. What we learned about the Live for Life model was that the key message it seeks to deliver about seeking support for yourself or on behalf of your friends was really being adopted by young people. We saw that within 6 months of having participated, 90% of young people had had a conversation about mental health following their the training in the mental health first aid and involvement in the Live for Life initiatives. And we saw that 1 in 4 Year 11 students had sought support for their own mental health in that intervening 6 months. And seeking help was defined fairly broadly from, visiting a GP, using a info line or a web service, to having a conversation with someone around them saying, things might not be great, I might need some help. The peer-led component of the model was also shown to be really critical. What we learned was that young people want to learn and hear about mental health issues and experiences from other young people. And I imagine for many of you that this is going to feel like a no-brainer of a finding, but it was really strongly reinforced and validated from the feedback from young people. What they valued most about what was being delivered to them was when they heard from young people, heard about their experiences, heard about how it could get better, and that included conversations with people in their own orbits as well. Embedding the model at a local level with that place-based approach and embedding it in the local community was also shown to be really protective, and local communities felt that that was really protective in terms of the longevity and their ability to deliver this model sustainably and over time, with a really clear recognition from everyone involved that the mental health prevention initiative that's being undertaken is generational change that's being sought. It's not going to happen in a number of years in terms of the big picture impact that's being sought. So that recognition that embedding at the local level, having local council and local health organisations, schools really buying in would help ensure that continuous delivery. And we also learnt that the model both relies on, but also fosters a highly networked community. And that was seen to have benefit for the communities in other ways. And I think particularly through pandemic response, for example, having the community of school and community partnership group, which all principals across sectors attend, was a channel of communication that might not otherwise have existed. Finally, the other learning about the strength of the model was just that it's a universal model for the community that it's in. It touches all young people in a community. And while not all young people in those communities will need or want everything that Live for Life is delivering for them, for those who did need it, it was shown to be really important and at times life-saving. So they were just some of the key learnings that we identified around this particular model. And I guess, what does this mean for supporting young people in mental health initiatives more generally? What we identified was the effectiveness of a place-based response, and particularly in a rural community. And just that recognition that statewide initiatives often don't land as strongly in rural areas for a whole range of issues. This can be around workforce, access to services, and a gamut of other things, but the recognition of particular rural responses. Really wanted to highlight that learning that the people who are around young people are a really critical piece of the puzzle for the young person with a need accessing timely support. So yes, we also need sufficient local services. We need the awareness of the services, but mostly what we saw is young people going to a person in their direct sphere of friends or networks. It might have been parents of their friend, and that is the first person they are likely to signal that they need some support. So building the confidence and the competence of the people around young people, teachers, parents, sports coaches, as well as young people themselves, was shown to be really, really critical in leveraging young people accessing support. And the other thing that I would really hope is taken away from this work is that young people really, really want to hear from other young people. And thinking about this prevention space in particular, that, you know, health professionals, teachers, parents, everyone in between is important, but who they really sit up and listen to is the stories from other young people. Their lived experience was really powerful. So I guess I would just want to encourage everyone to reflect on those learnings, and we have the conversations about what all this means and what we can do about it. They were some of the learnings that I wanted to share today.
Amazing. Thank you so much, Natasha. I've actually only very recently become a mental health first aid facilitator through Live for Life. So Live for Life and mental health awareness in rural areas certainly has a very special place in my heart. So thank you so much for your insight today. We really appreciate you coming along and being a part of Reshape Our Future. And last but certainly not least, we're going to hear from Cronje and Kirsty Fealy. Cronje has a strong passion for understanding and improving youth mental health. She is currently studying to become a clinical and forensic psychologist while working as a peer leader for the Global Ambassadors Program at Headspace Werribee. Cronje hopes to graduate in 2023 and continue to work in the youth mental health sector. Her goal is to advocate for and empower young people regardless of their background. And Kirsty is a young Ngunnawal woman who has a strong passion for the promotion of youth participation, awareness around youth mental health, and cultural awareness and connection. She is currently at university studying education whilst looking to move into social work upon completion. Kirsty also dedicates her time to working and volunteering in the youth space, specifically working as a peer leader for the Global Ambassadors Program at Headspace Werribee. Kirsty hopes that she can be a part of the movement and continue conversation about the importance of young people and their place in the world. And I will hand over to the two of you now to take it away. Thanks so much for joining us.
Thank you so much, Jen, for those intros and nice pronunciation with the names. As already been said, my name is Cronje and I prefer the pronouns she, her. I'm currently a peer leader at Headspace Werribee, and I'm coming to you from Melbourne, but I'm originally from South Africa.
Thanks, Han. My name's Kirsty and I'm a proud Ngunnawal woman. I'm also a peer leader at Headspace Werribee and I prefer the pronouns she, her. Just before we begin, we do want to take a moment to recognise and acknowledge that we are presenting on First Nations land, and we want to pay our respects to all First Nations people, past, present and future. And we also want to extend our respect to all First Nations people that are here today.
So we are here to talk about the Global Ambassadors Program, also known as GAP. This is a 9-week program aimed at culturally and linguistically diverse young people to promote resilience, mental health and well-being. We do so through facilitating respectful discussions around cultural identity and the students' experiences of acculturation stress. We also teach students skills to help them translate the conversations we have about culture and mental health into their local community beyond the program. GAP is completely youth-led and aims to benefit all key stakeholders involved. At the moment, the stakeholders are the school students participating in the program, the young people implementing and delivering the program, as well as the generous organisations funding the program, which is Scanlon Foundation at the moment. So GAP started back in 2018 as a small pilot run, and right now we are currently wrapping up our 6th iteration in our local community.
So within each school, we had about 10 culturally and linguistically diverse young people from year 9 and 10. We met with them at their school over a period of 9 weeks, with each week having a different topic of focus around which we facilitated conversations. So the structure of this 9 sessions involved a combination of discussion-based content, group activities, and also individual activities. So the sessions ran as so. So the first session was around getting to know me, getting to know you, where we introduced GAP and where it fits into the young people's lives. The second session focused on cultural identity and life experience. So through a cultural iceberg diagram, we helped unpack and create discussion around how culture is represented within the young people's lives. The third session looked around understanding stress, where we unpack stress and how to manage it through mindfulness activities. The fourth session was about resilience and strength, where we focused on what resilience is and strategies on how we can be more resilient in challenging cultural situations. The fifth session focused on understanding emotions, where we used an emotional pie diagram to help visually represent how we manage these emotions. The sixth session was around communication, where we focused on different communication styles and how culture impacts it. The seventh session was around social and cultural stereotypes, where we discussed what stereotypes, prejudices, and discriminations are and the strategies that we use to manage response to these with real life scenarios. Our eighth session focused on community connection, where we discussed how they can apply what they've learned in the sessions and how they can continue their learnings in their school, family, and community. And then our ninth session was a little bit of fun, where we celebrated the success and then we reflected on the achievements of completing GAP. So through each session, we ensured that we could provide young people with practical activities and community-led discussions around cultural mental health that assisted in providing them with a safe space and a better understanding of mental health services available. This was all with the aim of creating discussions and reducing stigma around culture and mental health, as the reform has outlined. One of the most special parts of the program is the wholesome moments that we get to experience with the young people who attended the session, and we want to take a moment to share some of these reflections. So just a few months ago, I completed a full 9 sessions with a group of amazing young people with a local school, and the most significant moment that I have taken was when we had a conversation with a young person that expressed that she loves having these conversations about culture and listening to other perspectives around their culture. She also expressed to us that she doesn't really get to experience these conversations often and that she wants to be present in them always. So this was a really special moment that we could clearly hear and see the importance of GAP within this young person. And this program does provide us practical ways of doing so.
So Kirsty and I obviously love GAP and are strong advocates for the program, but we also want to give you a sense of how the program is received by the participating school students. So we aim to evaluate every iteration of GAP to give students the opportunity to provide us with anonymous feedback. So I'm going to read you some of the qualitative feedback we got from students from the previous evaluation we did. So one student wrote, the program helped embrace ourselves in all aspects. It helped me gain more confidence in who I am. Another student wrote, I overall enjoyed this program because we have an opportunity to have discussions about topics we don't really talk about ever with peers and other adults. And lastly, another student wrote, great job on this. It was probably the best program I've been in. Now, we can tell you that these are not just words on a page that students wrote down to make us feel better about the program, but that we actually witnessed these changes in the students ourselves, as already mentioned by Kirsty. With most, if not all, iterations of GAP, we watched as participating students become more comfortable and confident in who they are and take pride in their cultural identity, which we know all contributes to good mental health among young people. So in the long term, we believe that number one, GAP facilitates safe conversations around cultural mental health that is not always spoken about freely among culturally and linguistically diverse young people. And this ultimately starts help to break down the stigma that these young people may be experiencing in their communities. And number two, we believe that GAP teaches students valuable skills to embrace their culture in their everyday life beyond the program as a means to build resilience and also improve their mental health. So thank you so much. That's it from us. Thank you for listening, and we look forward to answering your questions later.
Awesome. Thank you so much, Kirsty and Marie. Some amazing insights you brought to us today, and I can hear the passion in your voice. It's so good to hear and to see. So yeah, thank you so much for that presentation. Now we are going to head into a brief Q&A. We've got all our amazing panelists back. Thank you, Zoom wizards. And we actually don't have time for too many questions, but I have got 2 really good ones that I'm hoping we might have time for. I'll put them out there, and just noting that we won't be able to hear from absolutely everyone, but if you do feel comfortable to answer this question, please just turn your mic on and fire away. So yeah, we've only got about 5 minutes for Q&A, super speedy, but we'll see how we go. The first question I've got here that has come through the chat. So thank you to everyone who submitted questions. What provisions are there for care coordination? It's not okay that young people are discharged after ED presentations for suicide attempts and followed up with text messages and no contact with other community supports. Who would feel comfortable answering that question? Yeah, Pam?
I could make a couple of comments to that. I totally agree. It's unacceptable, but I know it happens in the system, and it's happening today, and it's probably happening to an individual. And the reality is that the Royal Commission has said the future system can't do that. The future system has to effectively provide a wide open front door for a young person to walk into, for an adult to walk into, and even a family with an infant or young child to walk into, and that local service effectively assists with the navigation elsewhere in the system. And I think what's really exciting in the youth space is that Commission said, you know what, there is an equivalent front door at the moment, and it's Headspace. And I know someone raised this in the comments. And so one of the priorities we have at the moment is to negotiate with the Commonwealth as to how we can effectively support the accessibility enhancement of the Headspace platform, to use the Headspace platform as more of a front door of entry, and to have the state specialist system providing support down into the front door of Headspace. I may not have answered the question completely, but it's a central part of the feature of the new system.
Yeah, thank you so much for your response there, Pam. And yeah, amazing that you've just acknowledged it all as well. We really appreciate that. I've got one more question, and then I think we might have to close the Q&A section, but opening it up to the panelists again, how do we empower young people to come forward and be able to gain agency without wait times and not have to agency hop?
Right, I think I might jump in, coming from a young person perspective. I know our role at Headspace Werribee, the idea of creating GAP is to kind of tackle that issue. So providing community-led programs within schools, within other community centres, as an alternative way to access sort of mental health support. So we know as well that a lot of cultural groups, the way that traditional mental health services are created aren't necessarily adapted for cultural groups. So having these community-led programs does assist in reaching those sorts of, I guess, huge barriers that we have, and so that we can kind of be able to help as many people as we can in multiple different ways, and so that we don't have people jumping from agencies, but we have sort of like a familiar face within a sort of organisation that can help young people get help.
May I jump in there as well, Jen? Thank you. I completely agree with those comments, Kirsty, and I think some of the rationale in the Live for Life initiative, for example, is around recognising that there are access issues in those rural communities, and there's no silver bullet to some of those issues. So the better you can build the confidence and the competence of community members to just help hold those young people, to understand what they're experiencing, to hopefully destigmatise around those young people, is not the same as accessing a service, but it provides a degree of support in the meantime.
Yeah, great. Thank you so much, Natasha and Kirsty, and Pam and Marie as well. Your insights just now have been wonderful. I do unfortunately have to wrap up this Q&A section because we have to move on to more amazingness. But thank you to everyone who submitted questions, and thanks again to our panelists for your marvelous responses. We're going to head out into breakout rooms shortly for small group discussions. But before we do, I just want to say a final thank you to our four wonderful speakers, Pam, Natasha, Marie and Kirsty. You've all been absolutely amazing to listen to today, and I'm sure all our attendees have really appreciated your knowledge and insight that you've brought to this session. I certainly have, so thank you so much for being a part of Reshape Our Future. You've been an absolute delight to listen to. But for now, I'm going to hand back to our fabulous MC, Kelsey, and Kelsey is going to run us through how these breakout rooms will work. So I'll hand back to you, Kelsey.
Thanks, Jen, and thank you so much, everyone. I always wish there was more time for Q&A because it's so interesting to hear what everyone has to say. And I can see the chat has been popping off with everyone's insights and experiences, which is really cool to see. And now we really want to give you all the opportunity to speak with one another. We're going to, like we have in the other sessions, given you a question to answer on Menti, but this time we're going to get you in a small group to speak with each other about your experience and your work and how it applies to this question. So the question is, what should be the priorities for implementing the recommendations from the Mental Health Royal Commission? We will put you into breakout rooms in one moment and we can start discussing with one another. We'll come back in a few minutes after that as well to wrap up the session. Group's discussion. It was really interesting to hear about the different issues that people from rural areas and metro areas and kind of the distinct issues that everyone experiences in terms of mental health support and access to services. But I think it's interesting that despite there being so many differences, that kind of one of the main things or the common themes that has come across today is that in mental health support, peer-led, youth-led, community, place-based projects seem to be what young people really want and what is needed to improve mental health. So thank you all. Nuri is just showing some of the responses that we had from the group's discussion. So while you have a look at those, I will just wrap up the session. I just want to remind everyone that obviously today this session can be quite heavy and it is a lot for some people to deal with. So I encourage you all, we do have a 30-minute break now. So go and grab a cup of tea, have some food, do what you need to do to feel good. But also one of my colleagues is going to post in the chat some helplines that you can contact if anything has been triggering for you today. We also have a welfare team available to speak to from YACVic if you would like to reach out to one of us to have a bit of a chat. I want to thank Jen, Pam, Natasha, Anne-Marie and Kirsty one last time for the incredible insights. I wish we could have heard from you for even longer, but we really appreciate your time today and sharing your experiences with us. Like I said, we're going to go into a 30-minute break. So you can use this opportunity to have a screen break, or you can go on Hopin and we've got 2 different networking functions that you can use. There's a group networking, or you can connect one-on-one networking with someone. You can also visit the expo where you can access presenters' slides and other important information from throughout the day. So at 2:30, there will be 2 parallel sessions running, young people in rural disaster recovery and emergency management, which I imagine will be of interest to the many rural people in the call right now. And then also at the same time, we've got young people leading peace and connection. So just reminded that they all will be recorded. So whichever one you go to, you can watch the other one later on. Thank you all for your participation today. It was really cool hearing all your insights. And I look forward to hearing what else you have to share over the next 2 days. Go enjoy your break and we'll see you at 2:30.
Yay!